Adenoids are a group of mucosa-associated lymphoid tissue. They are present at the roof and junction of the nasopharynx. They grow until 7 years and regress after puberty. They have a role to play in our immunity. They are surrounded by pseudostratified columnar epithelium and they do not have any crypts or a capsule. The blood supply to these adenoids are from maxillary artery, ascending palatine artery, ascending pharyngeal arteries. The nerve supply includes 9th and 10th nerves. Why does adenoid hypertrophy occur? It occurs due to recurrent attacks of sinusitis and rhinitis, also due to allergy of the upper respiratory tract. The clinical features of adenoid hypertrophy includes, in the nasal features, we have nasal obstruction, which leads to failure to thrive by the baby because feeding does not occur properly. Nasal discharge due to choanal obstruction, sinusitis due to persistence of nasal discharge and obstruction. In inflamed adenoids, epistaxis can also be seen, and in children, usually nasal voice is observed. Oral symptoms: tubal obstruction, which is the obstruction of the eustachian tube, attacks of otitis media. General symptoms include having an adenoid facies, which includes chronic nasal obstruction, mouth breathing, elongated face with a dull expression, open mouth, and crowded upper teeth. These patients experience hypoxia due to nasal obstruction, which leads to pulmonary vasoconstriction and then which again becomes right-sided heart failure. As a management of adenoid hypertrophy, adenoidectomy is done. The indications include sleep apnea, chronic serous otitis media, recurrent sinusitis, dental malocclusion. They usually, during adenoidectomy, the position of the patient is Rose position, where extension at the cervicothoracic and atlanto-occipital joint is seen. For adenoidectomy, tonsillectomy, and tracheostomy, the patient is placed in Rose position. The instruments used are Boyle's tongue blade, Davis mouth gag, Draffin bipod stand. There are two methods of adenoidectomy. One is cold method, where no heat is used, only curettage and microbe debriders are used. In hot method, the cutting and coagulation is done at the same time. The adenoidectomy is contraindicated in cases of cleft palate.